standing directly the other
Okay, I'm
side.
gonna start.
Okay. Yeah, that would have been. That's fine.
This station is designed to test your ability to perform a patient assessment of a patient with a chief complaint of a medical problem and voice treat all conditions discovered. You must conduct your assessment as you would in the field, including communicating with your patient. You may remove the patient's clothing down to shorts or swimsuit if you feel it is necessary. As you conduct your assessment, you should verbalize everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how you would normally gain that information. You may assume that you have 2 EMTs working with you and that they are correctly carrying out the verbal treatments you indicate. You have 10 minutes to complete this skill station. Do you have any questions?
No, ma'am.
Okay. You are dispatched to a 22-year-old male with difficulty breathing.
Understood. I'm arriving on scene. I'm examining the scene. Does the scene look safe?
Scene is safe.
I'm going to don my body substance isolation procedures as appropriate for the patient. Looks like I have one patient. His nature of illness appears to be difficulty breathing. Since I am an EMT, I'm going to immediately request ALS. I don't think I'll need the fire department for him. He doesn't appear like we'll need extra lift assist for this situation. Sir, have you fallen at all recently?
I have not.
No? Okay. I don't think there's any need to consider C-spine stabilization here then. Like I said, there's one patient. Sir, what seems to be going on today?
Just having a little bit of trouble breathing.
Little hard time breathing. All right, his chief complaint is difficulty breathing. He's obviously alert. And my general impression at this point is a strapping young man with some moderate difficulty breathing. Now that I've accomplished all that, I'm going to get into my ABCs. I was speaking to him before, so I know that his airway is patent. I'm going to listen quickly on either side. He does have equal lung sounds bilaterally. Given that he has difficulty breathing, I'm going to immediately start him on 15 liters on a non-rebreather of oxygen. I'm going to palpate for a radial pulse. Radial pulse is present, strong, and of normal rate. Feeling his skin, it's warm, dry, and of normal color. And taking a look, I see no indications of any major bleeding or need for bleeding control. Is that all correct?
Patient's skin appears pale and diaphoretic. All other assessments are correct.
Understood. I'm going to call my ALS en route and give them a quick update, ask them to please expedite. We have a 22-year-old male with respiratory distress. We've started oxygen. He is currently breathing. All right, and then I'm going to jump right into some vitals. Sir, I'm going to take your blood pressure. Can I see this arm? Thank you, sir. Big day today, huh? Breathe out a little extra. His blood pressure was 146/92 by manual auscultation.
Blood pressure is 186/96.
Understood. I'm going to palpate a radial pulse, look at my analog watch. The watch isn't moving. All right. His heart rate is 64, strong and regular.
Pulse is 120, strong and regular.
Understood. He appears to be respiring at 24 breaths a minute. They are deep and labored.
That is correct.
Understood. So, sir, what was going on when this all started today?
I just finished up mowing the lawn.
Is there anything that makes it easier for you to breathe, positioning or anything like that?
When I lean forward like this, it's easier than when I'm sitting up.
I understand. Okay. What does that feel like? Is it just like you can't get a deep breath, or do you feel like it's physically hard to get any air in?
It feels like there's stuff in my lungs.
Do you have any pain anywhere?
No.
Okay, there's no pain. I'm not going to consider radiation in my OPQRST. Scale of 1 to 10, how bad is this episode of difficulty breathing?
6.
A 6? And how long has this been going on now that you have had a hard time breathing?
15 minutes.
Okay, that's my OPQRST. I'm going to start my ample assessment. Do you have any allergies?
No.
Do you take any medications?
Yes.
What are they?
Albuterol. I have an inhaler.
Have you used your inhaler today?
It's empty.
Well, that's quite unfortunate. Do you have any past medical history that's relevant to your experience today?
I got diagnosed with asthma when I was younger.
You have asthma. Does this feel like previous asthma attacks you've had?
Yes.
When was the last time you ate or drank something?
Today for lunch a couple hours ago.
Okay. Take any medications?
Just the albuterol.
Okay. Did you successfully take any albuterol, or was it empty?
Empty.
It was empty? Okay. And what was it again that was going on before this all started?
I was out mowing the lawn.
You're out mowing the lawn? Okay. Well, that completes my OPQRST and sample. I'm going to do my focus assessment of his pulmonary system. Take a nice deep breath for me. Good. Another one? 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 Good. His lung sounds are clear and equal bilaterally.
You hear wheezing in the left and right lower lobes.
Understood. Could I get an oxygen saturation now that he's on the 15 liters non-breather?
Oxygen saturation is 98.
Okay. Well, given that he has wheezing, I'm going to administer a Duoneb 2.5 milligrams of albuterol and 1/2 milligram of ipratropium via nebulizer. Do you prefer a nebulizer mask or a nebulizer pipe?
Mask works.
Okay, I'm going to have my partner set that up for me, and then we're going to reassess him every 5 minutes. He is an emergent patient. We're going to continue emergently to the hospital, and it appears that my ALS is arriving now. I'm going to update them. We have a 22-year-old male patient with a history of asthma and a chief complaint today of difficulty breathing. On our arrival, we initially applied 15 liters via non-rebreather. Upon discovering that he had bilateral wheezing, we've now just started a Duoneb treatment. He is significantly hypertensive, mildly tachycardic, but he is well saturated with the 15 liters non-rebreather, and we'll see how he opens up with this Duoneb that we just gave, and I'm done.